let's use. No. in the world. I think
The virtual audience didn't hear your.
Oh, they didn't hear my
No, and they didn't hear your
Oh,
paragraph.
Okay, we spare them.
Oh.
Yeah, you're good.
Sorry, unmuted.
Yes.
Oh, yeah, okay. Got my face. I'm sorry? You can introduce the speakers. Yeah, we have voice for them, yeah.
Oh, yeah. Oh, yeah.
Yeah, these are- oh, wait. I didn't even start with you. See that? Speakers are easy there. I gotta leave it into as well.
Oh, thank you.
So for those on Zoom, give us a second. Rinse.
Did you want to just?
For those on Zoom, hang on for a second.
Appreciate it.
Okay, ready? So, good afternoon, everyone. Thank you for joining us today in this session. And this is the title of our session. We have a really exciting group of folks to speak with you today, to share their insights with you today. My name is Robert Hirokawa. I'm the CEO of the Hawaii Primary Care Association. And we have the pleasure of having three Hawaii FQHCs, or federally qualified health centers, with us today. We have Hawaii Island Community Health Center. We have the Lanai Community Health Center, and we have the Waianae Coast Comprehensive Health Center with us today. And the presenters, I will ask them to identify themselves when they speak, introduce themselves when they speak. Okay. It's not going. So these, thank you. So these are, okay. So these are the session objectives. The first one, I'll cover the first one. I'll provide you with an overview of Hawaii's federally qualified health centers, also known as community health centers. And the second two bullets will be covered in detail from our presenters from the three FQHCs. So who are we? In terms of the Hawaii Primary Care Association, or HPCA, We provide all varying levels of support to Hawaii's FQHCs. It covers the spectrum of many things that we do for the health centers. We provide support in terms of advocacy and policy support. We provide resources to the health centers. We put on trainings for the health centers and also provide technical assistance. In terms of federally qualified health centers or FQHCs, they are federally funded nonprofit health centers that serve in medically underserved areas and populations. They provide primary care services regardless of the person's ability to pay. But they also, in addition to primary care services, they also provide oral health services. They provide mental health services as the purpose of today's discussion. They provide substance abuse treatment. And some health centers also provide vision services as well. And I want to pause for a second or take a little bit more time to explain that very last statement, social determinants of health and enabling services. The reason why I want to spend a little bit of time here is because this is what really, I think, distinguishes FQHCs from a typical private practice in terms of the services that they provide. So enabling services, there's a lot of terms for this enabling service, so-called enabling services, but basically these are the types of services that are non-clinical in nature. Things like interpretation services or in terms of helping a person deal with their food insecurity, for example, or housing instability. Many of the health centers have legal services provided to their patients to deal with things like landlord and tenant issues or transactional law, meaning helping them to fill out forms, et cetera, to apply for certain types of services. So these are the types of services also known as wrap services or wraparound services that health centers also provide as well, in addition to primary care. So in terms of FQHCs in Hawaii, this is where they are located. We actually have 14 health centers, FQHCs across the state. The impact of the health centers in 2022 is that they served about 160,000, a little bit less than 160,000 patients across the state of Hawaii in 2022. Also provided over 700,000 visits as well. So you can see that we have one health center on Kauai. We have 7 health centers on Oahu. We have 4 health centers on Maui County, 2 on Maui Island, and of course, 1 on Lanai and 1 on Molokai. And we have 2 health centers on the Big Island, Hamakua Kohala Health and Hawaii Island Community Health Center. In terms of the patients that health centers serve collectively, this is the demographic characteristics of patients served. 55% are on Medicaid, about 52% are live below Hawaii's federal poverty level, about 10%, little less than 10% are uninsured, 20% Native Hawaiian, 14% are other Pacific Islander, and this also includes our compact nation citizens, 22% Asian, 90% non-Hispanic white, about 8,000, little over 8,000 homeless patients are served each year, and about 20,000 patients who come from public housing, and finally about 3,700 veterans are served by Hawaii's FQHCs. In terms of demographics of children served by FQHCs, of that 160,000, about 30% are children 0 to 18 years of age. And in this subgroup, about 6% are uninsured and 56% are Medicaid or CHIP. And what surprises me here is that 6% of our children are uninsured. Now, switching to school-based healthcare, which is the topic of this session, just wanted to share with you some important or some interesting points of fact in terms of where health and education intersect. And so that first bullet, I'll just read it to you because this is how we feel. It's a powerful avenue for achieving health equity among children and adolescents experiencing disparities in outcomes. The second bullet is actually from a study. And what they found, it was actually a literature review, and what they found, the main findings of that literature review was that school-based health centers improve health outcomes for kids in schools that they serve. And also they provide better access to care as well. The third bullet, which is the second study here, it was actually a longitudinal study that in Colorado that showed that schools with school-based health centers on premises actually experienced a higher graduation rate. And it was higher for males. It was actually improved graduation rates for both genders were higher for males. And I believe that our presenters today will provide you with more evidence of the importance of school-based health centers as it pertains to Hawaii. So what is a school-based health center? So basically, it's a student-focused health center located in or adjacent to a school where students can receive integrated medical, mental health, and other types of healthcare services. And it ensures that students have access to high-quality healthcare when they need it. All 14 of Hawaii's FQHCs provide school-based health services. Now, I want to make a slight distinction here. What I mean by school-based health services is that all of the health centers in some form or manner partner with their local schools to provide some type of healthcare service. It doesn't necessarily mean that they're on premises. So that's why I refer to it as a school-based health service. All 14 health centers do this. And this became very apparent during the COVID era. This is when it really became very important. In addition to that, we have 4 FQHCs that actually have sites on the school premises, meaning that they have a school-based health center. So we have Waianae Coast Comprehensive Health Center, Hawaii Island Community Health Center, both have sites on premises. Hamakua Kohala Health on the Big Island also has sites on schools, on a charter school, and Waikiki Health has a mobile unit that they drive to the school. These are our panelists, our speakers today. Cecilia from Hawaii Island Community Health Center, Drs. Ponce and Young from Waianae Coast Comprehensive Health Center, and Dr. Arcy Imasa from Lanai Community Health Center. Oh, and so now next is Cecilia. Thank you.
Thanks, Robert. Hi, everybody. Nice to meet you. My name is Cecilia Royale Sakata, and I'm from Hawaii Island Community Health Center, and I am our school-based health director. So today I'm going to just share a little bit about what Hawaii Island Community Health is doing in school-based health centers. As Robert mentioned, we're an FQHC. We were in partnership before becoming Hawaii Island Community Health Center. There were 2 FQHCs on the island of Hawaii, and it was Bay Clinic and West Hawaii Community Health Center. We merged and created Hawaii Island Community Health Center. And so now we serve both the east and west side of the island, and we have a clinic further south as well. On the screen, you'll see the pink dots are our community clinics, and the crosses there are all of our school-based health centers. Right now, we have a total of 6 school-based health centers. 3 of them are in full operation. That means that they have medical, dental, and behavioral health on a rotating schedule throughout the day. We have 2 school-based health centers, one in East Hawaii and one in West Hawaii, that will be opening in mid-October with full services. And then one in Pahoa that will just be operating as a behavioral health care coordination with the clinic that's located in Pahoa community. So from the map, you saw that we're quite a large island with very few resources, just 2 FQHCs on island, but a decent amount of health centers. However, due to the rural setting of Hawaii Island, the public transportation is a big barrier in accessing care. And so that was one of the big decisions for Hawaii Island Community Health Center to look at school-based healthcare. Because despite having a decent amount of clinics, we saw that coordinating care for students to access behavioral health wasn't successful. So in our school-based health centers, we have all of these different services. And before we launched all of these services, we did a coordination of care model in the schools where we worked with the school staff to coordinate with their MTSS, which is the multi-tiered support system in the school, to identify students that would benefit from behavioral health support. Through the care coordination program, we worked with the school to create appointments inside of the health centers, not inside of a school-based health center. This was the precursor to school-based health for us. And what we actually found was that 74% of the appointments that were made for students were either canceled or no-showed. Students were not making it into the health centers despite the coordination of care to get them there. So that's really what spurred our decision to move into school-based health, is that this care coordination model wasn't as successful and we weren't reaching as many students as we knew that needed it. And one of the decisions was expanding the medical home, right? The APA has stated that traditionally having a medical home, which we support, is a good idea, but a school-based health center can be a partner in a medical home to create access for students who have barriers. So this is a look at what we're seeing in the school-based health centers. For our referrals, 48% of the students that we're seeing were referred for trauma. And what that really tells you is that this is a systems issue, right? Because kids are a part of a system. And so when we're looking at how we're treating the patients that come to the school-based health center, we're not just looking at the individual patient, we're looking at, as Robert spoke about, enabling services. How can we use our enabling services to also connect and affect the family system? So supporting the student where they have access in the school, and then also reaching out through our enabling services such as patient navigators and care coordinators to provide services and connection to address social determinants of health with the students' families and outside of the school. So the school is an avenue for us to treat the patient and open a door to supporting the family as well. I might be moving a little too fast here. Okay, so this is the big picture of how Hawai'i Island Community Health Center is approaching behavioral health in the school. And first and foremost, direct on-site care. As I mentioned, coordinating care outside of the clinic, students on Hawai'i Island were struggling to reach their appointments. And so having that direct on-site care has gone from a 74% no-show cancellation rate to a 98% rate of appointments kept. 98% of the students that we have scheduled for behavioral health are being seen in their appointments now. So the shift in access is amazing to see. Second, as a resource, providers, a missed appointment means that a provider's time in a very important appointment isn't being utilized. What's very nice about school-based health centers is that we have a running list of students that need to be seen. And so if a student happens to be absent, we'll know the morning of that appointment that that student is not going to be there today. And so we can go to our wait list and instantly fill it with another student that's already on campus. So we're really utilizing our providers' time very well, which in a medically underserved area is a very important thing to do. So direct on-site care is the best model. Second, we're approaching prevention skill building. So as a part of the school-based health centers, we have school-based patient navigators. And what we do is we have specific behavioral health patient navigators that are trained to do skill building activities with the students. So they're coordinating inside of the school to work with teachers and school staff to identify students that may not be quite ready for a referral to a pediatric psychologist, but could benefit from expanding their toolbox, right? And so we're doing prevention skill building using CBT. inside of the school. So they travel through the different classrooms, either students that are referred or just as a whole entire class, to prevent these students from going into crisis. We're trying to build their skills and prevent crisis. Additionally, we're coordinating care. So a lot of times a parent or a school staff member may recognize that there's a need, but not understand or not have the skills or knowledge of navigating the health system to ensure that their student gets access or their child gets access or the right type of care, right? It can be overwhelming just for us to navigate things sometimes. And so coordinating the care with the parents and the students' support staff at the school has been very successful for us. Being a part of the school's multi-tiered support system to identify exactly what challenges, and then partnering with the student's parent to get a look at both school and home. So you have a very big picture of how these students can get support. And of course, all of this is done with a release of consent to release information, but it helps to widen the open the scope of what we see about the students and the best way that we can support them. Additionally, understanding the behavioral health landscape. Just medical staff in general, MAs, front desk, sometimes have a hard time understanding what actually exists inside of a behavioral health landscape and the different levels of care that are in that landscape. And so one of our approaches has also been supporting school teachers and administrative staff in understanding the behavioral health landscape and educating them in that landscape. So then, for some reason, if they needed to help a student navigate behavioral health, we're also empowering them with the knowledge of what community resources exist and what services exist to help that student navigate and help that staff member help that student. Additionally, we're looking at tiered care. And so part of that tiered care is having a behavioral health patient navigator in our school-based health center on a daily basis. While the pediatric psychologist might rotate through on a Monday and a Friday or a Monday and a Wednesday, and they have a full schedule, there's always a behavioral health patient navigator on site to assess what level of care that student might need, and then referring them. Are they in crisis? Do they need a crisis call? Would they be a good fit for skill building? So having these skilled behavioral health patient navigators inside of the school, manning the desk at the school-based health center, helps to alleviate crisis and ensures that students are accessing the level of care that's most appropriate for them. Again, when we have limited resources like Hawai'i Island, which is very rural, very hard to hire few pediatric behavioral health providers, we want to use those resources very mindfully and very effectively. And so having tiered care inside of a school-based health center is really helping us to navigate and direct patients to the right service. And then, of course, screening and assessments, using the tools that are readily available to us to help us make decisions about how students are referred in kind of that hierarchy of care. A pediatric psychologist isn't going to be the first line of defense, and they're definitely not the last line of defense. There's child adolescent mental health that kind of comes after that. And so helping to use tools to make decisions that improve student and health outcomes. We're not going to see a patient for X amount of time when the root of the problem might be a family systems issue. And so creating a system and assessment that helps providers and staff understand when to make that next level referral. Oops, sorry. Okay, and so really what we found at Hawai'i Island Community Health Center is that number one, the students are in need, the schools are in need, and the staff are in need of support in the area of behavioral health. There is somewhat of a behavioral health crisis, whether it is from the pandemic or it is because of a systems issue in the economic landscape that we all exist in right now. But there is an issue and there is a need for help. And so having behavioral health services inside of the school helps to reduce some of the barriers to accessing care and improving the systems. Parents don't have to take off of work to drive their student to an appointment. Students are having access. They're having more time in their seat. They're achieving better academic success because they're having less time away from school. And when you achieve academic success, then you ultimately see better health outcomes. So that's it for me.
I forgot to mention that we'll hold the question and answer until all of the panelists have spoken. So next we have Dr. Arcy Imasa from Lanai Community Health Center. So just to change the slide, you just right.
Hi, everyone. I'm Arcy Imasa. I'm a family medicine physician at Lanai Community Health Center. Just a little bit about me. So my family come from recent migrants, yeah. So I did my high school in the Philippines, and then I did my undergrad at UH Hilo. So I'm from the Big Island. And then I worked so hard, but also with the support of the community, I got to where I'm at now. So I'm saying that because I see a lot of young folks here that might benefit from them, from that message. Anyway, I would like to share now about our clinic's mental health work, specifically the Lanai Community Health Center. So some relevant background to the mental health work that our clinic does in Lanai. So our Lanai Clinic has been serving as a community partner for the mental health services, yeah. So our clinic is the only federally qualified health center in the island, and the island itself is rural, very isolated. It's the smallest island, and you can imagine the challenges of being an isolated island and being rural, yeah, especially with transportation, access to care, so on and so forth. We actually have to fly out our patients to Maui or to Oahu to get the services that they need, sometimes including mental health related services. Yeah. So the Lanai Clinic has been a partner with the Lanai High and Elementary School for a decade. We provide health lessons to the students of the school, and each year's efforts become more impactful to our youth with each lesson that our clinic teaches, yeah, to the students. With our mental health initiative program, what started off as a group of second graders getting one health lesson a month has now turned into a whole physical education, health education program fully ran by the clinic. And this program is run by our clinic staff for all elementary and now into all middle school grades. So the mental health initiative of Lanai Clinic, how did it start? So there was a unanimous concern about students' mental health because of the impacts of COVID, yeah. Pretty much COVID killed kids' ability for sports and outdoor events. And this triggered for the Lanai Clinic to develop a main action plan for mental health education for the students. And this action plan aimed to promote movement as a stress reliever or a stress outlet. So movement is the focus, yeah? And teachers and students reported that stresses and anxieties were affecting the students' ability to learn even when virtual education has ended and everyone was back to in-person schedule. With the input of the Lanai's schools leadership and the help of the County of Maui's Recreation Department, we designed the program, and Lanai Clinic now hosts the skills and drills physical education from K to 5th grade students bi-weekly for 45 minutes per grade. So we get the students out of their classrooms and we do this sports and outdoor events. We have been doing this since mid-2021, this past school year of 2022 to 23, and also this semester. And we plan on completing the whole school year this year. So overall, the impacts of Lanai Clinic's mental health initiative for the youth are one, it gave the youth the ability to be successful during their movement drills. I call it movement drills because that's when they're outside the clinic and they're very, very busy, very active. Yeah, and it also helped them accomplish physical goals that boost their mental health and mood. You can imagine the kids constantly running around, using their high hand-eye coordination skills and so on and so forth. It also benefited the youth by building their team skills through physical activities, and this gave them a chance to build on their social skills and self-esteem. It's a big deal for the youth or the students to have 2.5 years of their school life doing distance learning and virtual education. So these movement drills became outlet to express themselves. The social skills, part of the movement was incorporating communication skills for expressing their anger, frustrations, and other emotions. The community health workers kept in mind that we were also addressing the bullying issues, the performance anxiety issues that the students have when we're doing their movement drills. Students were also taught skills that connected them to the extracurricular activities, such as keiki basketball and volleyball activities through this program. Yeah, you can see it here. Students are outside, so that's at the park next to the school. It's just one of the many events in this bi-weekly movement drills that we had. And lastly, the mental health initiative developed further the trust of the community to the clinic as a servant to the youth and, of course, their families. So I have here a student testimonial coming from rainy season, who is a 5th grader of the school. So he was very active in this movement drills. And then because of his participation, experience, and the influence and connections that he got from attending our mental health initiative, he was able to join the County of Maui's Basketball League. And this is Rainy's mom, Kathy, who was very grateful to see how our clinics collaboration with the school really helped Rainy become very active and develop the confidence that he needed to, we could say, be where he's at this point. Yeah. Thank you.
Dr. Imasa, I just want to pause for a second. Is everybody okay on the Zoom? I just want to make sure. Any questions about being able to hear us or anything? Okay, looks good. Okay, so next we have, oh, sorry. Next we have the team from the Waianae Coast Comprehensive Health Center.
Sounds good. Hello, everyone online and everyone in the audience. I'm Keone, and I'm Jonathan. I'm the medical provider for Waianae Comp school-based clinics, and Jonathan's our behavioral health provider. I noticed we have a lot of students right here, right? How many here are students? Wow, awesome. So I remember being a student at this event wearing that green shirt, volunteering, and I never aspired to be up here, yet here I am after a few years. So I'm grateful for this opportunity that we have to share a little bit about our clinic and the Waianae Coast Comprehensive Health Center. So our main center was founded in 1972 on the leeward coast of Oahu. It's a nonprofit organization, as mentioned, about being a FQHC, which addresses health disparities, improves population health, and reduces health inequalities despite financial and cultural barriers. We focus on three things: healing, learning, and innovation. I fortunately was lucky enough to be part of the learning, where I was a resident with the Waianae Coast Comprehensive Health Center. And we actually went to one of Cecilia's clinics on the Big Island, and we did COVID immunizations during the middle of the pandemic. So it was pretty neat to see this kind of full circle event. But with it, we do focus on these three aspects as our mission as being a community health center. Some of the services we provide are as listed here. Phones that I want to focus on mainly, of course, are primary care clinics, family medicine, internal medicine, pediatrics, women's health, and of course, our school-based health clinics. We also have specialty providers that come in: general surgery, ophthalmology, OB-gynecology, orthopedics, periodontology, podiatry, psychiatry, psychology, and dermatology, and chronic pain management. As far as our school-based clinics, these are some of the demographics. So we have clinics in 3 of the main schools on the west side: Waianae Intermediate, Waianae High School, Nanakuli High, and Nanakuli Intermediate. And we're actually expanding to Kamaile Academy shortly. But as you notice, this is kind of the population of students. And then as far as the statistic of the Native Hawaiians being 64%, 70%, and 82%, and 51%. And so one thing interesting with that is the 82% for the Nanakuli is interesting because majority of that is homestead, Hawaiian homestead lands. Meanwhile, with our Kamaile, there's a big population of Micronesians that are now affiliated with that chartered school.
So as mentioned before, my name is Jonathan. I'm the psychologist at the school-based health center. So I provide direct psychotherapy to a lot of the students we have in these locations. And so our school-based health centers, we provide acute care, vaccinations, physicals. Right now, I'm primarily giving individual therapy, and we're looking at expanding to behavioral health group therapy. That's something we've been working on. And something about our team, we have a small intimate group. We have 2 individuals actually on our team. One is a care coordinator and another is a social worker. And they're the ones who actually collaborate with the schools and kind of build the bridge between us and the schools to kind of collaborate on the school's needs. Because as you've seen, we have 3 schools right now that we serve, and we're going to be expanding to Kamaile and actually Nanikapono, and one more, Waianae Elementary. But each school on the leeward side has specific needs. So not every school has the same thing. So those 2 are specifically been helpful in trying to figure out what are the school needs. So for instance, Nanikapono, the one that will be opening up soon, their needs specifically are for behavioral health services. And they have just as big a school as looking at Waianae High School. So there's a lot of need out there. And then at Kamaile, it's more of the physicals that are needed. So we provide health education, and something that's unique to us, we offer telehealth services. So communicating between the schools. You guys use Title Care. So if we're in one location, we can provide telehealth services to another school, or if a student is unable or absent that day, they can actually be seen for behavioral health services in their home, and I'm able to see them there. So that's something we've been working with. And so just for myself, I just kind of wanted to share my experiences with the schools and what I've been seeing. And so these are just kind of primarily some of the diagnoses I've been working with, the primary ones. Not all of them fall under this category, but these are just the primary ones. If you guys remember back in high school, it's not always the easiest, or a lot of transitions that you go through. So adjustment has probably been one of the biggest things, a lot of developmental changes at that time. What we see down at Waianae side, though, we see a lot of transgenerational trauma that occurs over there. So I think on the Big Island too, that was kind of a big number for you guys. We have similar numbers to that. And what I've seen is that the trauma is also inducing a lot of the depression, a lot of the anxiety. And there's a lot of students down that side who haven't been diagnosed with like ADHD or learning disabilities are autism, and it's just because of it's not known in our communities. The parents don't understand what that is, what it looks like. And so the Waianae Comp we celebrated 50 years last year. So we've only been around for 50 years, and the school-based health centers started in 2016. So it's about the 7th year. And so we're just kind of starting this out, trying to get understanding to the communities to help them understand what our services is, what these diagnoses is, and what mental health is. And so that's been kind of my biggest challenge in working with the community, is working with the parents. But this is kind of just the main things I've seen. Of course, not all of it. So here's just some of the lists that we've had success with. Just providing healthcare access. That was a big thing with the comps being something that started on the west side, because prior to that, everyone would have to come all the way down to town and access was really difficult. But now we have one clinical center that has all of it: vision, dental, medical, behavioral health, everything. And so it makes it a lot easier. And for the school-based health centers, we've noticed that the access is a lot easier for the parents, because that was one of the hardest things, is just getting them out. It didn't work for their schedules. It's an underserved population. So parents are working sometimes 24/7. They can't bring their kids in. And so what we do is we're able to call them out of the classes, see them for their services, and it just makes it a lot more convenient for the parents. So when I see a student, I'll reach out to the parents, talk to them, make sure we're all on the same page. I've received referrals from the main comp, from MDs. Actually, we do warm handoffs in the clinic. So if he has anyone, we do a screener. And if the screeners are high, or if there's something that's said, like suicidal ideations, homicidal ideations, anything like that, they can just hand them off to me, and I'm right over there, which makes it a lot easier. So we've actually had quite a few of that, and it's interesting to see the need that is out there when you're actually working in it. So providing core services, mental health, like we mentioned. We have a Keiki Pantry. We kind of help with just providing food, just the bare necessities when looking at like Maslow's hierarchy of needs, just the bare safety, food, shelter, things like that. We try to help with in our communities, social services. But some of the challenges that we've seen through our side and what we work with is just, like I mentioned, the awareness of the services that are offered. So I think just this past year, as the school year started, we were in the schools during the orientations, kind of letting families understand what our services is, what we provide, and they're all like, wow, you give physicals on campus. They had no idea. Behavioral health services. So they're all very like excited about this news, and we all get a common thing where they're saying, hey, I wish I had that when I was going to school. And so the really cool thing is that our MAs too in our sites, our clinics, a lot of them graduated from these schools themselves. So it's kind of comes full circle. And a lot of our team is very community oriented and wanting to give back. So their hearts are all in the right places. So our team is really awesome in regards to that. So increasing services offered, getting the signed consents done. We have signed consents so that the students will have access to all the services needed. So yeah, and I think the biggest thing is just kind of reaching out to the parents and helping them helping to spread awareness to what mental health looks like out over there, because it's fairly new. When you think about it, it's a fairly new thing, and it's not common knowledge, and mental health is not something that's commonly addressed in our society. And I think it's something that needs to be normalized and talked about more. So that's kind of what I work with a lot of students. I provide play therapy, cognitive behavioral therapy, and just psychodynamic, and addressing a lot of that the transgenerational trauma that comes out sometimes. So yeah, that's kind of what I do and what I serve for the Comp Center. So thank you guys.
Hang on the people on Zoom. Hang on for a second. Okay, thank you. So we have a lot of time now. So we actually, I think we go to, I want to say 3:15. So we can go ahead and open the floor up for questions from in here, from the audience. So we also have questions coming in from our chat on the folks that are on Zoom. So does anybody have a question to start with? I see Val back there from MRSA.
For the YNI cost comprehensive, I heard that you're doing mental health as well. So I was wondering if you guys are like communicating with other school aside from the schools mentioned, and is it virtual or face to face?
Hello. Okay, it works. Good question. So yeah, right now we're expanding. So we've been serving the 3 schools, the Nanakuli High and Intermediate, Waianae Intermediate, and Waianae High School, and we're expanding to a few more schools. So this is kind of just a process, and we're looking to expand more. But it takes time to do those sort of things and addressing the needs of the community. And while that's going on, we're also expanding our clinic as well. So yes, we have been in communication with the schools. That's why we'll be opening up, I think, 3 by the end of this year and serving. And the telehealth, so I primarily work in person. So I see face-to-face, but it depends on the needs and the complexity of the cases. So sometimes I'll see virtually if they are deemed telehealth appropriate, if it seems what's going on can be managed through telehealth. But if something is more severe, or maybe there's suicidal ideations, depression, things like that, maybe I'll see them in person. So I schedule them for in-person days, but it's a lot of jumping to different schools. So yeah, no, I provide both, and it just depends on the complexity of the case.
So this is a question for Cecilia. What are the campuses that the on-site services will be provided at for the Big Island?
Oh, I can just talk. Okay, I thought I had to turn it on. So right now we have Kalakahe Elementary, Kalakahe Intermediate, and Hononau Elementary that have operating. They're fully functional right now. We have Konawaina Middle and High, which will be opening mid-October, and Kalaniana Ole Elementary and Intermediate in East Hawaii that will be opening mid-October, and then Keone Poko Elementary in Pahoa, which will be opening around December. All of them have on-site services, a location on campus, yes. So a clinic location on campus, an exam room, dental chairs, a lab, the whole scope of service.
Just wondering how the logistics of the school-based services happen. Do parents routinely join the kid at the visit, or do you do phone consents, or how does that all work? And then what happens when an urgent comes in and you're like, you gotta go home? Who handles the parent? You need to pick them up.
Yes, I can answer this. So we do have them fill out an online consent by the parent or a form. A lot of times they'll be coming in for sports physicals or well-child visits. And so with it, it kind of comes down to the preference of the parent. If they want to be there, that's great because they're a better historian than the kids. But with it, we do physicals as well with just the child. And then I'll go ahead and call the parent after to give them an update and make sure they're all on board with the plan and moving forward with any treatment options. But yeah, and then there are those cases where we have acute visits where people will just come in for headaches or menstrual cramps or all sorts of things. We do even have some emergencies. The hard part with the West Side is, of course, the emotional trauma and everything that comes with there, why behavioral services are so important. But there's a lot of substance abuse. Just yesterday, we had the in thing with these dabs, these THC inhalers, and one of the kids overdosed. So we're able to be there to assist with that. And so, yeah.
And I'll just add something that we might do a little different, and I don't know if you guys do this, but you just didn't speak to it, is when we're scheduling well child exams or any medical appointments in advance. And, you know, same thing, we have a consent that the parents complete prior to the visit. Our nurses will call ahead of time to talk about any concerns that should be addressed in the well child visit if the parents aren't able to attend. And oftentimes we offer them a telehealth component to join virtually, to join the well child or the medical appointment virtually.
I have two questions. So the first concerns, it sounds like some of the services maybe were performed by school personnel in the past, some of these things to some degree. And I'm just wondering, have there been any issues, you know, around that in terms of what is done at the school-based sites versus by the school personnel themselves? So that's the first question. The second question concerns payment. And I'm just wondering, have there been any issues or problems regarding payment by or reimbursement by payers for the services? And I know that the students are generally going to be covered either under a Quest plan or a private insurance plan. So on both sides, I'm just curious, what your experience has been.
So to answer the question about school services that are performed by other school staff, I think what we've done at Hawai'i Island Community Health Center is to really delineate that we are in support of what the school is doing, not in place of what they're doing. So we're making a clear delineation and not stepping on the toes of services or not providing services that are previously in place. If a student, say, has a behavioral health concern that they might have an IEP for, an individualized education plan, and they're receiving support from a school-based behavioral health provider through their IEP, they might not be, depending on how many hours or minutes that they have available to them in the month, they might not be the best candidate to then also see the pediatric psychologist that's on site. Sometimes they are, sometimes they're not. But really just having open communication and being aware of what services already exist. And kind of in the health realm, I think it's important that on Hawai'i Island, most of our schools don't actually have a school health aide right now. It's a very hard position to staff. Most schools don't have one or are constantly kind of in a turnover phase. So they don't even have what we would traditionally think of as a nurse on campus. Hawaii Keiki Nurses does kind of play a part in some of that, but they're not readily available on all of the campuses. And so school-based health centers have kind of stepped in that, but really just working in partnership with the front office that they handle calling the parents, they handle emergencies, we handle scheduled appointments and acute care visits if needed.
I'll piggyback onto that as well. I know for us, there was a little bit of not controversy, but the school staff felt a little threatened, right, with their jobs. We're coming in here, we're going to lose our positions as school medical assistants and nurses. And with that, we did need to get some buy-in by them. I know a lot of times with one of our clinics, we weren't getting any patients really because they get kind of triaged through the school medical nurse. And so with it, we did have to foster that relationship in order to be able to then get our services more out into the school and to getting the kids involved with our services.
I would also add that oftentimes schools are understaffed and under-resourced. So we're pretty welcomed with open arms mostly because they see how the work that we're doing can contribute to just a better overall school community and health of the school community. And so it improves their working conditions. It improves their student outcomes. And so overall is a positive impact to their workplace. And your second question, we haven't had any issues with reimbursement from payers.
And then I know for Waianae Comp, we don't take Kaiser insurance, which was kind of tricky because a lot of patients did have Kaiser, but fortunately we're enough to get a Kaiser grant where we're able to cover their medical expenses and certain medications so they can still receive service yet have that insurance plan.
Hi. I had a question about how the partnerships with the schools are made. Like if it was based on the school's need, like the schools that were most in need of healthcare were chosen, or if it was like you reached out to ones that were in the area of your guys' clinics, or if the schools reached out to you. I'm not sure.
Yeah, so for us, with our expansion at Waianae, the school base at Waianae Coast Comp, a lot of the schools saw that there were school-based health centers and they kind of reached out needing the services from us. So each school, like I mentioned, was a little bit different. We'll be opening at Nani Kapono, and so their need, they specifically said, was more towards behavioral health services. And so we've had meetings with them to kind of see what they have. They have a whole integrated care system out over there. And they're looking to kind of implement help from, so actually kind of answering a bit of your question, when I specifically work with the schools, I make sure to collaborate with the counselors, the principal, because it's all a team, right? We're all coming together for the same purpose. And so again, we're not here to step on any toes. We're just here to add to the needs of the school and the community. So that's what kind of our focus is on. But yeah, I haven't had any issues. The schools have been trying to reach out. Actually, they've been trying to push us to come in sooner than we can. And so we're trying to meet the demands that's out there. But yeah, it's been open arms as far as I know. And I'm pretty sure that we're only on the leeward side, but other schools are looking to similar things. And I would say probably down the years to come, decade or so, it's going to be kind of a common thing across the island because it's such a good system and it's been so helpful for a lot of students. So yeah.
I would add that when we're looking at expansion, we're also using Strive High data, which looks at the number of students that are in the school, what percentage of the students are free and reduced lunch, qualify for free and reduced lunch, because that indicates a poverty level and what students might benefit most from an on-site school-based health center where they might not otherwise be able to access care.
Any more questions from the audience? Oh, I see. Oh, I'm. I'll repeat the question for the folks on Zoom. The question is for BH, are you providing med management? Thank you.
Yeah, so the way we operate is as if we are in the Waianae Coast Comprehensive Health Center. Just so happens our clinic is located in a school. So it's as if a clinic is in the school. So if it needs to be med management, I will refer out in the clinics for medication. I have sent out some for ADHD. I've even referred out for testing, psychological testing. But yeah, that is an option. And it's actually, sorry, my ear. No. I do not handle the medication. We refer out. So our system is you come to see behavioral health, and that goes for all of Waianae Comp. And then the psychologist will kind of refer out to see a psychiatrist for medicine. It'll depend on the demand at the time because it depends on the season. It's Christmas, New Year's, summer. It kind of depends where we're at, but they try to book them, and we've created a more efficient model at behavioral health to kind of make them seen. I'd say the wait time has been maybe about 2 to 3 weeks at most. And I just had some referrals out and they've seen them. So that's kind of where that's been at. But we check in with them depending how it is. And if people need to get moved up, if it's more of a MH4 crisis situation, then we can kind of push things through too.
I think the neat thing with it too, with our relationship being medical and behavioral health in the same clinic, is that I will initially do like a PEDS confidential screen, and then there'll be some red flags or a PHQ-9, and then I can immediately do a warm handoff with Dr. Ponce, and that service can get started right then. So that's the neat thing with our model, I guess.
Yep.
And I would answer for Hawaii Island Community Health that we have a psychiatrist on staff at High CHC. And we also have one that sees pediatric patients. So we just do an internal referral. We're an integrated care clinic. So they could see medical and behavioral health. And then if needed, they would be referred to our internal psychiatrist.
Okay, any more questions? Oh, wait, bring back.
Hi, okay. You folks talked about helping students. Are there current programs within your organizations that educate parents on how to support the students?
Actually, it's funny you brought that up. Yeah, we actually just had a meeting with some people about coordinating groups for parents to kind of educate them, because I have seen a lot of autism that goes undiagnosed, and just kind of spreading that awareness. So it's been in the talks. We don't have any specific parent groups, but we do refer out for parent groups. I have made some referrals for that, but we're looking to kind of integrate that into our system as well. And we've been in talks with some people in the mainland, actually, that's kind of bringing their systems and how they made it work, to see if that would be something we can fit in. But yeah, that's on the list of things to do, on the list.
And for High CHC, we often, if it's become aware that parent education might be needed for that specific patient and their family, then we make a referral for the family to be seen inside of one of our community clinics.
Hi, this is Francis Chan from Hawaii Health Information Exchange. Just a curious kind of thought, because not all the students that you see at the school actually use the community health center as their quote unquote medical home base, right? So the services that you provide to those students, or especially for behavioral health, then do they somehow get back to the PCP out if the PCP is not part of the clinic that you are based at? Mm-hmm. And how do those records get over to the other PCPs that is outside of the system?
So for us, we do have students who do have primary care providers that are outside of the Waianae Coast Comp Center. So what we do is we get release of information from the parents, and then whether they were seeing a psychologist outside or a PCP outside, we'll get that information, and then it'll be transferred, because once that would mean they would have probably a first visit with us. For me, I've had a lot of first visits. So we'll kind of get their background, their history, and have that sent over to us. So that's kind of how we work with someone who's new, and then through collateral information through the parents, that's been helpful. So I make sure to kind of work with the parents on that. But yeah, it's not really an issue. I've had people come from out of state, actually move from like Florida, and we've got ROI and trying to get information. I've spoken to a lot of other providers in different states to just kind of see what the presenting issue was, what is needed. And I do have some students that need medication as well, so they have to go through to come see me, and then I'll refer them out for medicine as well. So
We use a very similar process where we just use a release of consent and communicate with the pediatric provider. Typically, we're not seeing students who have a private provider inside of the school-based health center. We're not wanting to displace, private PCPs in the community. So we won't typically see them for medical, maybe on an urgent care basis, but many students who have a private primary care provider in the community do access our behavioral health services. And so we just use a release of consent and also parental communication.
So I'm going to turn over to, we have about 4 questions from our Zoom participants as well. So I'll just read them. I'll summarize it. And actually, the first question actually pertains exactly to what Francis just asked. And this person, this doctor is asking, or had a situation where a patient was referred over to, this is Big Island, referred over to the Big Island Health Center for BH services, but the patient had to become the health center's patient. So can you explain, I think, that feedback loop, all the PCP referring to you, and how does that happen? How does that patient go back to the PCP?
So prior to the existence of school-based health centers, Hawai'i Island Community Health Center's practice was that in order to access our behavioral health services, you needed to be a patient of Hawai'i Island Community Health Center because we're an integrated care facility. However, with the creation of our school-based health centers, we wanted to open access to all students to behavioral health on campus because we realized that that was one of the biggest needs in the school. And so that for students being seen in a school-based health center, they do not need to be our primary care patient. They can be a patient of a private provider in the community.
Thank you. Anybody else? Yes. Any other?
For us, it's also the same thing. So they don't have to have a PCP at our clinic. I've seen individuals who come in and we just schedule an intake with them and then they can be in our system for the Waianae Comp Center. So we just need to get them scheduled in with us to be seen and then we can kind of establish them part of our system.
Thank you. Okay, I'm going to go to the next question. I'm going to sort of paraphrase this. The question basically is that during school breaks, when school is on break, right, summer, etc., is there any way for a child to receive care during these types of breaks?
Go ahead.
Great question. So yeah, during the break times, actually this past summer, we opened up the clinics to be seen. So I was still providing behavioral health services in the school. And like I said, we do telehealth services. So if they're not able to make it in the schools, I can tele a video with them for their services. But also if for some reason they can't come into the schools or telehealth doesn't work or they want to be seen in person and something doesn't work out, I can refer them out to our main clinic as well and they can be seen there. So for me, I actually work 1 day in the main clinic. And so I do 4 days at the school base. So I've had referrals to myself at the main clinic on the days I'm in. So I refer them out and I just continue care within the main clinic. So it's just if they need to be seen during break, it's just an easier process. And if they want to be seen by another provider, that's totally available for them too.
We use the same process. We offer telehealth. We keep our doors open we kept our doors open during the summer break. And part of that decision was because there was summer school on campus. So students were still accessing the school-based health center. We offered telehealth for students who were not attending summer school. And then our provider, just like Jonathan, she rotates inside of the clinic. So students had the option to be seen in clinic if they were able to get there.
This is incredible because the next question, it's like we practice this or something, because the next question is just following what it's like a piggyback thing. The question is, for telehealth, are there different types, or consents? Are there different consents that a child would have to go through, or the parent would have to go through to consent for telehealth? Since you're talking about telehealth, that's the question. Is it a different consent?
We communicate with every parent before every appointment, so the parents are aware of whether or not it would be a telehealth or a face-to-face appointment. They wouldn't, if they are strictly a school-based health center patient and they had a school-based health registration and consent on file, the telehealth would come from the school-based health center. The appointment would be delivered from the provider inside of the school-based health center. If they are already one of our PCP patients, then no, there isn't any additional special consent that would be needed.
For us, we kind of have a blanket consent. So even like I'll see a patient in school, get tests running, they'll go home and then I'll finish it with telehealth. And so parents are always involved and nothing's going on behind anyone's back, of course.
Thank you. Dr. Imasa, you have anything to add about anything?
No, I'm learning a lot too from because a lot of the questions doesn't really apply to Lanai. We're only working with one school and any mental health services that the students need, they come to the clinic. So we've taken care of all of those. But it's really neat to see the systems in place that the bigger FQHCs have already. Yeah.
I can just add that what you just described, Dr. Imasa, is very common in other health centers as well. So other health centers in Hawaii don't have quote unquote brick and mortar on campus, but they still provide school health related services at their clinic sites, right? So that's, I think I just wanted to mention, there's a spectrum of care of how it's delivered with the health centers in Hawaii. And by the way, school-based health centers are, they're very prevalent across the entire country. There's many school-based health centers across the country as well.
Yes, with telehealth, one of the requirements that we've been required, and this is through the DOD providing telehealth with kids, is children under the age of 13, the parent needs to be in the room when you're providing service. Children over 13, the parent needs to be there when you start the service, but they can leave the room so that the child has better privacy. I don't know if you follow that ethic or not.
I'll answer for high CHC. Often children under 13, we're not offering them telehealth. Occasionally we will, and the parent will be in the room. But we found that it's not as effective with the younger, telehealth isn't as effective with younger kids. So it's rare that we use it. And if we do, a parent is invited into the session.
For us, actually, we have something called kiosk in our clinics, and that's where we'll provide telehealth services within the clinic to be seen. But if they can't be in the clinic, I will see them at home. And I do, we let the parents know, hey, we get their consent, and it's in our consent forms too, that we may provide telehealth services. And I let the parents know, I talk with them ahead of time, hey, if they need to be seen, I contact the parents prior to and let them know, hey, we're gonna have a televisit. Do I have your permission to do this? So that kind of works with the parents. So yeah, we're kind of flexible in regards to how I see them and make sure that all the consent is taken care of.
Thank you. And I'm going to go to my the last question that's asked on the Zoom. And it's a little bit of a different question, a little bit a different take on what's happening here, but it's a very important one. And the question is just asking about the Maui fires and what happened to the kids who are displaced there and how are they getting their care, and is a health center involved? And so the answer is absolutely yes. So we have our Malama, I apologize, I'm speaking on their behalf, but I will try my best to represent what's happening on Maui. So we have the Malama Ikeola Health Center, also known as the Community Clinic of Maui. One of their site, their Lahaina site actually burned down. It actually burned to the ground in the fire. It was a satellite clinic. So they lost that site. And so what happened very quickly right after that is the Department of Health, in partnership with the health center, Malama Ikeola, and in partnership with a whole host of other nonprofits. Another one is Hui no Kealapono, which is part of the Native Hawaiian healthcare system. They had a pharmacy also participating. They basically stood up a clinic right adjacent to the burn zone. And so they're providing care there. My assumption is they're providing care to all ages, kids included as well. And so that clinic was stood up about maybe 3 weeks ago, something I'm looking at, about 3 weeks ago. And it's so interesting to note that we have 2 health centers here that are sending providers from their health centers over to the Lahaina site to help with the staffing there, to help with making sure that the staffing is adequate. So we have Waianae Comp sending providers there. We also have Hawai'i Island Health Center sending providers there as well. So to answer the question, yes, the health center was, Malama Ikeola was in the direct impact zone, and they had to quickly stand up the health center, the clinic to provide care. But even before that, they were also providing care at the shelters. So the shelters were stood up, I think, the day after the fire, and they were providing medical care. They deployed medical teams to the shelters as well. And of course, as you know, the shelters have been closed down now. I think everybody was moved into hotels and to Airbnbs and such. But so the clinic no longer has to do that anymore. But again, the health center is providing care at this stand-up site that was erected right after the fire. And again, Waianae Comp and Hawai'i Island are sending providers over to Maui to help. So that is the last question on the Zoom. One more is a question right there.
Hi, you mentioned that there's some triage done by people who are not mental health providers, maybe school staff or even office workers. I was wondering if you could speak a little more to that, describe what that looks like, how that training is achieved for the triage. Yeah.
So I guess the training sorry. Oh, yeah. I can't speak for the schools themselves because I don't know like what their specific protocols are. All I can speak for is how we work with the schools specifically. So working with the counselors, just the faculty, and sometimes even the teachers that come in, because we do follow different laws, right? FERPA versus HIPAA, very different. So we have to make sure we're following those. But yeah, we kind of find a way. So like, for instance, at Nani Kapono, when I was talking with them, they have a kind of tier system. So they work with like maybe students who are just need to be seen for something minor. They'll come into counseling, and then I think it's a 5-tier system they have. So for our part, they want us to kind of play tier 5, where it gets to the point where, does this person need severe mental health services? And we're trying to see how we can fit into their model of what they need. And so we're kind of there to assist the school, right? And what their needs are. So that's kind of how we've been playing with, kind of seeing where we could fit for them. But yeah, it's just a big collaborating process with the different schools and what their need is. But yeah, that's kind of how we've been working it.
Yeah, I was trying to think of the acronym. I think it's SHA, Student or School Health Aid. So they're kind of the ones that initially students will come to them first with, oh, I feel sick or I have a headache or whatnot. And they kind of see what they can do, and then they'll refer to us as needed. So.
And I would just add, what High CHC is doing is helping to educate school staff and administrators on recognizing behavioral health, diagnoses, maybe not diagnoses, but kind of some of the behaviors that might indicate that a child needs the next level of care or referral. And so we've done like little mini sessions with some of the school staff at the schools that we're at, to support them in understanding when kids might be a good fit for referral.
And we'll wrap up with our last question.
Is this on? Okay, is it on? Okay. Excuse me. I hope I can say this the right way, but I want to piggyback on one of the previous questions about training the parents, or kind of that theme. So let's say it's kind of I'm asking about the depth of service. So just for example, you get like a suicidal ideation, you see the person, but then you send them right back into the causal environment. We also talked about getting the parents' permission to see them. What if the parents is the cause? So is there a mechanism to expand beyond the symptom of what you're addressing and go after more root cause type situations? Does that make sense?
If I'm understanding correctly, kind of like if the trauma's in the home, how do we assist with? I know when we always ask, of course, if they're in any imminent harm, and if they are, then we get CPS involved, and they become the other entity that kind of assists with that environment. I don't know if is that kind of where you're asking or going with that question?
I think so. It's just more of a systems approach, not addressing simply the symptom of what's in front of you, but going at a more of a depth.
Yeah.
So I think the nice thing about a federally qualified health center, having a leg of school-based health, is that parents could then, if something is environmental in the home, that the FQHC isn't just a pediatric practice. We often treat adults too. So a referral, a phone call could be made by the provider that's seeing the child, assess what might benefit the home parent system, whoever's caring for the child, and then refer them into the clinic, offer them access and coordinate care for the parents inside of the clinic. Perhaps they could benefit from a behavioral health referral, psychiatric services, a medical situation, or maybe to one of the patient navigators that is addressing the social determinants of health to reduce the stress on the family by connecting them to food, shelter, transportation, any of those things. So I think as an FQHC, those enabling services are addressing the system. Did that answer you okay?
Yeah, I think so. Thank you.
I think for myself, I work not just with the students, right? I make sure I also work with the family too, because I practice in different modalities. So working with family systems is really important. And so as we're going to open up and expand to elementary schools, I'm making a point to make sure that there are sessions that the parent is there and present. Because I do have sometimes parents who are like, hey, here's my child, solve it, right? And so we don't operate like that. And I tell them at the beginning of the session that this is a joint collaborative approach. I've had some sessions with the families just coming in, right? Working together. And so that's the kind of approach we take in behavioral health, because we recognize that it's a family systems, right? It's not just the student. So that's kind of, I can speak for myself at least.
I know, I mean, when it comes down to it, so I also get to work with homeless outreach. And oftentimes I'm at the tail end of their healthcare where they just want a quick fix. I think the beauty of school-based is we have the opportunity now to make the changes necessary to hopefully prevent those negative outcomes in the end in providing that access and that availability for them to better their lives holistically, right?
Hi, everybody. Just here to let you know that there's going to be a research poster competition held outside in the lobby. It's consisting of high school students, undergrad, postgrad, and residents. And there will also be free ice cream. So feel free to check it out.
Okay. So before you get the free ice cream, please round of applause for our incredible speakers today. Thank you all.
Good job, guys.
Yeah, no, it's perfect. Oh, yeah. Yeah, can we get a picture? Just